Hi, my name is Pamela. I'm presenting benign prostatic hyperplasia. The patient is a 76-year-old male with a recent history of UTIs and complaining of frequent urination at night. His urine frequency and occasional incontinence and experienced nocturia has been a problem for his performance at work. His other medical history, including hypothyroidism and adenomatous colonic polyps, has some lipoma on the left anterior chest, and COPD, iron deficiency anemia. Has a DJD with a hip fracture. So his father had colonic cirrhosis and died in motor vehicle accident. Mother has diabetic type 2 and died with a chronic renal failure. He's currently employed part-time as a Walmart greeter and still smoker. Upon her PE physical exam, her vital sign is pretty normal, skin good, nose, ear, eyes, no problem, neck, no problem, heart, no problem, abdominal is obese, and forgot to mention he's also overweight. So, and genital rectal shows negative. On her digital rectal exam, there's a large prostate with a smooth surface, no distinct nodule or induration. He does have some varicose vein bilaterally and have some limitation of range of motion in both knees and some discomfort. So IPSS is an international prostate symptom score. It's a scoring system based on patients' subjective answer for screening benign prostate hyperplasia. IPSS has 3 categories: mild, moderate, and severe. Patient's score is 18, which fit into moderate sympathetic category. So what are the tests he needs? He has a urinary functional test, UA, CBC, BMP, liver, TSH, PSA. But why urinary functional test? There are 3 tests can demonstrate the ability of urination. Urinary function test has a uroflowmetry. Uroflowmetry is test the strength of urine stream. It is useful for detecting sphincter muscle. Patient will urinate into a funnel-shaped device, which is connected with the electronic device, and to measure the speed and quantity of urination. The bladder scanner is to check post-void residue. Those 2 tests are not a definite test. The pressure flow study is more definitely diagnostic test for bladder outlet obstruction. It is more invasive and required to hook on the pressure bag for measuring the detrusor contraction. So which urinary function tests are consistent with an enlarged prostate? On the right side are the reference. For this patient, uroflowmetry, the number is 7, which is lower than the normal. Means that his urine flow is much slower than people in his age. And the post-void residual are slightly higher. In general, the male greater than 65 years old should have less than 100 ml after the urination. So his has a slightly higher residual. The pressure flow study is significantly elevated, which is 74. The normal pressure flow study should be 0, but for him, anything greater than 40 is elevation. It's severe elevated. Sorry. So which urinalysis are abnormal result? His urine looks clear. Specific gravity is normal. pH is normal. The white count normal. Red blood cell, slightly bacteria trace. The urine is normally sterile, but a small number of bacteria may be found in the urine of many healthy people. So is this patient experience any electrolyte imbalance? Sodium 144, K 3.9, chloride 109, bicarb 32, glucose 119. Nope, he's pretty normal. Nothing wrong with electrolyte. Is the renal function normal? Yes, it's normal. BUN and creatinine is in the normal range, and indeed his other indication of he does not have hyperkalemia. His phosphate is also normal. It's not high, so it's indication of healthy normal renal renal test. The hepatic function is normal or abnormal. Patient's AST and ALT are all pretty normal. I have some reference number here. 31, 41 ALT, everything is all within normal. The LDH is slightly higher. LDH is lactate dehydrogenase. This test is slightly above a normal range. What does it mean? It could be indication of a heart attack, anemia, muscle trauma, cancer, or infection. But the fact of this patient has chronic iron anemia. So this is probably not an abnormality to see. His protein are in the low normal range, and it does not significant there is a liver disease. So the conclusion on this hepatic functional tests are normal, and the patient does not have any liver disease. Looking at the CBC, his hemoglobin shows 13.9 hematocrit, 41 MCV, MCH, MCHC are all pretty normal. So he's currently taking an iron pill, so it's pretty good. He's maintaining good. He does not show any anemia. What is the significance of the test results for the T4 and TSH? His T4 is slightly lower. TSH is significant elevated, greater than 4. His is 10.79. It's indication of his TSH is floating around in the blood. His TSH stands for thyroid stimulation hormone. So his body is not taking the TSH, and T4 is significant lower. It means that his body is not the thyroxine is not binding to the protein, so he has hypothyroidism, and he's already diagnosed with hypothyroidism. So what is the single most significant laboratory blood test result? The only thing that stands out is PSA 5.2, which is greater than 4. But elevated PSA does not necessarily indicate patient has prostate cancer. Other risk factors of elevation PSA are including elderly, people who are older, greater than 50, greater than 60. Every year, they can go higher. And sometimes UTI or ejaculation the day before can also elevate the PSA. So in my conclusion, the 3 strong lines of the evidence that this patient does not have prostate cancer are: number 1, I found digital rectal exam. His is smooth surface and no distinct nodule or induration. The prostate size is like walnut size, and generally it should be smooth to feel. It does not have any area of hardness or bumpiness. If patient has a prostate cancer, the biopsy will be required. But according to the USPS task force, this changed because they do not really encourage the patient to have PSA test. We can discuss it later. The other strong evidence that patient does not have prostate cancer is because he is obese. Obesity is a risk of increasing the BPH. And elevation of the PSA test. The evidence shows that 60% for men in their 60s, the PSA test is significant higher. They were 80 to 90% of BPH. As a man ages, the amount of active testosterone decreased relative to his estrogen level, which may influence the growth of prostate. Thank you for watching.